I get many calls and emails from patients around the world asking, where are the guidelines for nutrition to help me get better, because I'm not getting better. It's been many months and I'm still so weak. And this was one of those patients. Mervyn Singer referred this patient to me from the UK. And he said, I used to ski marathons, 70-kilometer races. Yes, people do that kind of thing. And then I got pneumonia. And he was 49, got pneumonia, was only in the hospital a few days. Got sepsis from it, was in the ICU, but a few days, ventilated for 1 day. In the hospital a total of only 10 days. 3 months following discharge, he couldn't even go up the escalators of the London Underground without being short of breath, without being exhausted. He worked with a trainer, as he'd done for many years. He couldn't gain any endurance or any strength. He said leaving the ICU, or leaving the hospital even, was like jumping off a cliff. There was no one there to help. There was no one there to give him guidance. We need to change this. Our patients shouldn't be living like this. So no one is immune to this. All our patients, unfortunately, suffer after they're in the ICU for any length of time. 60 to 80% of people will be severely disabled, like Melissa, who never returned to her work that she did before as an accountant. She's never returned to this day, and it's been many years, because of what happened in the 3 weeks she was in the ICU. So this is exceedingly common. In fact, it's an epidemic. Why are we losing this war? Of course, we know that a patient can lose a kilogram of lean body mass a day in our ICUs, even after major surgery. I'll show you later. How do we expect to get our patients to survive that and function again? And we know that the hypermetabolism and catabolism persists for months to years after this. Reed Vandenberg is even implying perhaps it persists for a lifetime. It changes our very genetics, where we remain hypermetabolic and catabolic. And the thing is, patients gain weight sometimes, we see this, but they're not gaining muscle, they're gaining fat, because they're remaining catabolic and they eat, but they don't gain strength. Why is that? What can we do? How do we start winning this war? Of course, this is going to take a combination of nutrition, rehabilitation, and perhaps even some elite sports tech. But again, they're never going to eat enough. You've seen data all night that they're not eating enough after ICU. And so oral nutrition supplements are mandatory. And I'm going to advocate to you that a 6-month minimum should be placed on every patient leaving the ICU to receive an oral nutrition supplement, because we know it's a minimum of 6 months even for a healthy person to recover from a starvation event and a lean body mass loss event like we put upon our patients. Nobody should be without an oral nutrition supplement for 6 months after ICU. It has to be that long, probably, or longer. And you have to teach them that ICU recovery has to begin the day of ICU admission, not as an afterthought after they leave your ICU and go to your floor where you know they're not going to eat the bad hospital food, and we know they're not getting anything they need then. We need to change that. This has to happen before. And this needs to continue long after hospital discharge. Again, 6 months to 2 years after hospital discharge. Because if we're going to create survivors of our patients and not victims, getting them out of the ICU is not enough.